Hi everyone. In today's class, we are actually going to see the structures that are actually related to the thyroid gland. So the thyroid gland, as you know, it is actually located in the lower part of neck. The isthmus lying in front of the second, third, and fourth tracheal rings. And the thyroid gland has two lateral lobes. We'll be having two lateral lobes, and the center portion sometimes you may see a pyramidal lobe. So basically the portion that you're going to see connecting the two lobes, this one is the isthmus. The pyramidal lobe might be seen just above the isthmus if it is present. The two lateral lobes on either side. You can see the upper poles and the lower poles. The blood supply is basically by superior and inferior thyroid artery. They are the one that comes from the superior thyroid artery is the one that actually coming from the external carotid artery, an anterior branch of external carotid artery. Right? So the external carotid artery is a branch that I'm going to see it in the neck. It gives a branch. The branch is superior thyroid. So the moment it reaches the upper pole of the lateral lobe, it divides into two branches. One branch runs in the anterior border, the other branch runs in the posterior border. Okay, so this one is the anterior border and this is the posterior border. The same applies to the opposite side. So the superior thyroid, on reaching the upper pole of the thyroid gland, divides into an anterior and posterior branch. So this is superior thyroid artery. Fine. Just above the superior thyroid artery, the structure that you see is the thyroid cartilage. So the gland actually reaches the oblique line of thyroid cartilage. So here I am not actually going to draw the cartilage. Okay, we are just going to find out a little bit of cartilage. I will draw it for your convenience. So the cartilage will be having a superior horn, will be having a notch, again a superior horn. I was going to draw the whole thing, the whole entity. The gland reaching the oblique line of the thyroid cartilage. This is the notch that you see in the thyroid cartilage. So this structure that you see just above the thyroid gland, this is the thyroid cartilage. Writing it short, cartilage. Just above the thyroid cartilage, the bone that you're going to see in the neck is the hyoid bone, which will be having a lesser cornua and a greater cornua. Right? A lesser cornua and a greater cornua, and the body itself in the center. The structure that is extending from the hyoid bone to the thyroid cartilage, the one that you see, is thyrohyoid membrane. What I am drawing is thyrohyoid membrane. So now we are coming to the nerves that are actually located. The nerve that is located very in close proximity with the carotid artery, obviously, is the vagus nerve. Just drawing the vagus nerve. So the vagus nerve gives a branch called as superior laryngeal. It gives a branch called as superior laryngeal. Superior laryngeal divides into two branches. So I am drawing the superior laryngeal. This nerve is superior laryngeal nerve. Superior laryngeal divides into two branches. The branches are external laryngeal and internal laryngeal. So the one that is running along with superior thyroid artery, so this one is external laryngeal nerve. The one that is going up towards the thyroid membrane. The one that is going towards the thyroid membrane and piercing the thyroid membrane is, so this nerve is internal laryngeal nerve. Internal laryngeal nerve. So now both the structures they actually pass close by, whereas the nerve is not actually going to reach the upper pole of the thyroid gland. Instead, it goes and supplies a muscle. It supplies a muscle. Just got drawing the muscle here. The name of the muscle that you're going to see that is related to the cricoid and the thyroid cartilage. Sorry, cricoid and the thyroid cartilage is cricothyroid muscle. So I'm just drawing the muscle outside for a convenience for your understanding. The muscle is actually located between the cricoid and the cricoid below here and the thyroid cartilage here. Fine. So the external laryngeal which is running goes and supplies a muscle. So it actually deviates from the superior thyroid artery before it reaches the upper pole. The superior thyroid artery before it reaches the upper pole, it leaves the external laryngeal. External laryngeal moves off from its path and goes and supplies the muscle. Okay. The superior thyroid artery gives a branch that accompanies internal laryngeal nerve. So both the structures, so this artery that is now a branch coming from the superior thyroid, this artery is called as superior laryngeal artery. Got it? So these two structures now pierce the thyroid membrane. Got it? So the external carotid artery, a branch of common carotid. This is the vagus nerve and the structures in the neck. So the external carotid artery gives a branch called as the superior thyroid artery, an anterior branch, reaches the upper pole of the thyroid gland, divides into an anterior and posterior branch which runs corresponding with the corresponding borders. The vagus nerve that is actually located in the neck gives a branch called as superior laryngeal nerve which divides into external and internal laryngeal nerve. The internal laryngeal nerve runs upwards, pierces the thyroid membrane, whereas external laryngeal nerve runs downwards. It accompanies the superior thyroid artery. When the superior thyroid artery is about to reach the upper pole of the thyroid gland, it separates out and goes and supplies a muscle called as cricothyroid. The superior thyroid artery, before it reaches the upper pole, gives a branch called as superior laryngeal artery. And superior laryngeal artery and internal laryngeal nerve, both the structures, they actually pierce the thyroid membrane, go deep inside, and you can actually locate the internal laryngeal nerve in a fossa called as pyriform fossa. So after this, it gets into the pyriform fossa and it supplies the sensation. It takes the sensation from the posterior most part of the tongue, basically the region of vallicula, and you can see that it supplies the larynx up to the level of vocal cords. Got it? The superior thyroid artery anterior branch which is coming anastomose with the opposite side, anterior branch, whereas the inferior thyroid which is running along the posterior border anastomose with a branch of inferior thyroid called as ascending branch of inferior thyroid. So ascending branch of inferior thyroid artery, anastomose with posterior branch of superior thyroid artery, whereas anterior branch of both the sides, the anastomose above the isthmus. Okay, this is a simple diagram showing, simple explanation showing the nerve and the vessel related to the artery related to the thyroid gland and the related areas. Thank you.